Hi, Dr. Gino Tutera. I'm the founder of the Sotapelli method for the usage of pellet hormone therapy. In our therapy, we're very specific in what we do. I firmly believe that if you're going to benefit from hormone replacement therapy, you need to do certain things. Number one is you need to use biologically identical hormone. Just think of it in a common sense manner. Is it better for you to get hormones from a horse, specifically from horse urine, or is it better to have the same identical hormone that your body once produced? So if you think of it, biologically identical hormone is basically a hormone that is identical in structure. So if your body makes a hormone that's shaped like my hand, being able to get that same exact structure enables you to get the same identical biological effect within you, as well as having the same safety profile. Unlike all of the literature that says that hormones are basically have bad effects, when did you ever have a bad effect from your own hormone? When you were in your 30s and your hormones were at their highest, you were flourishing. The incidence of breast cancer is absolutely the lowest. There is no prostatic cancer in men in their 30s. You know, the ability to fight off cardiovascular disease, diabetes, hypertension, obesity is basically at its height when you were in your 30s and you had the full complement of your own hormone. So having giving back the same hormone is very protective for you. Secondly, we specialize in giving you a form of hormone delivery that delivers hormone in the very exact ratio in which that hormone is produced within the body. Pills, patches, creams, shots, none of those produce that ratio, because that ratio is what gives you the internal effect and also the same safety profile. Thirdly, our specialty, because I've developed a formula for it, when you use pellet hormone delivery system, you need to be able to individualize the dose to each patient, because if you don't do that, then it can't truly be biologically identical for you, can it? No, absolutely not. Because of the fact that if you're giving everybody the same dose, then you're not taking into account each of the variables that makes you that individual. And then lastly, our delivery system is the only form of therapy that allows the body to control the release of the hormone through the action of your heart. A very simple demonstration is this. If this would represent a pellet and you place it underneath the skin, it develops a network of capillaries within a few days. Then as your heart pumps blood across this, your body becomes like a kid licking a lollipop. So that when you're exercising, that kid is licking furiously on that lollipop, releasing all the hormone you need to benefit in your exercise regimen and be able also to have you not store lactic acid, so that your body can increase its endurance and lower its your post-exercise your recovery time. Likewise, when you're sleeping then and your heart rate is much slower, you're going to be getting the exact amount of hormone you need for that particular time of day. So therefore, you have now a system with using pellets that delivers hormone that's identical to your own. It's the only form that gives you the proper ratio to protect yourself. Thirdly, it's individualized for your particular needs, and you have a delivery system that is delivering the right amount of hormone at the right time. How could you not benefit from something that is able to give you all of those benefits, which are completely unheard of when you're using pills, patches, creams, injections, or whatever? So if you have interest in what we do, and I encourage you to think about this seriously, please call us. Thank you very much for your attention.